everybody. This is Alexa Tinsley. I am the Director of Programs for Jett Foundation. Thank you all for joining us today to learn more about Ronald McDonald House Charities. We are going to go ahead and give people a minute to hop on, but if you are willing, we would love to hear who you are and you or your child's name and your location in the chat, and we will be back in just a minute. All right, we'll go ahead and get started. Hopefully some more people will hop on as we go. But thank you guys again for being here. Again, my name is Alexa Tinsley. I'm the Director of Programs here at Jett Foundation. We're really excited today to share with you more about Ronald McDonald House Charities. We have Kayla Roberts here, and we want to thank her for helping us make this webinar possible. Kayla executes marketing strategies and fundraising events for the Charlotte chapter of Ronald McDonald House Charities. And in addition, she manages the charity brand, fundraising campaigns, social media, pop tab programs, tours, and speaking engagements. And she just celebrated recently 2 years at Ronald McDonald House. Her story is pretty great. We will be, talking about Ronald McDonald House Charities and what the Greater Charlotte area has to offer, but Kayla will also be discussing general Ronald McDonald House charity information as well. So thank you for that, because, one of the reasons we decided to do this webinar was to share that, Ronald McDonald House is an option for families in this community and what they have to offer. So before we get started, I just want to mention a few things. If this is your first webinar series, we do these throughout the year. And it is being recorded. So if for any reason you do have to hop off, or if you know someone that did want to attend this webinar and was not able to attend, it will be recorded and on our website and on our YouTube for you to watch at a later time. After the presentation, we will be answering questions. There is a Q&A box for me, it's the bottom right, little 2 boxes put together that says Q&A. We will be primarily using that to answer questions, but we will be monitoring the chat as well. We do also look at Facebook and try to get to as many questions as we can there. So if you do have any, please go ahead and submit them. If for any reason we do not get to your question today, we will send them to Kayla to see if she can give us an answer after the fact. So again, I want to thank Kayla for being here and sharing this information with us today. And with that, I will hand it off to her.
Yes, thank you so much, Alexa. Hi, everybody. Like Alexa said, my name is Kayla Roberts. I am the Marketing and Event Specialist at the Ronald McDonald House Charities of Greater Charlotte in North Carolina. I'm excited to chat with you today. Like she said, I just celebrated my 2-year anniversary at RMHC. So I have been with the chapter for a little over 2 years, but I was a volunteer previously before getting hired on full time. I am currently living in Charlotte. Recently got engaged like 3 weeks ago. I have a little dog named Leo. And so we are just diving into life recently. I went to school at the University of North Carolina at Greensboro. I graduated in 2019. I was the last graduating class right before COVID. And 5 days after I graduated, I moved to New York City. I did not go to school for a nonprofit. I went to school for fashion merchandising. So traveled and, worked in the fashion industry right out of college. And then during the pandemic, decided to move back to North Carolina from New York. And then the pandemic really taught me, I want to do something that I'm really passionate about, something that makes me feel like I have a true purpose. So that led me to nonprofit and led me to Ronald McDonald House. All right. So
congratulations, first of all.
Oh, thank you.
We're so happy for you.
Thank you so much. It's still really new, but yeah, thank you. I always like to start out my presentations with a family perspective. I can, more than happy spit out some facts and tell you as much as you need to know about RMHC, but no one tells our story better than our families. So I'm going to share Emmy's story with you guys. Can we hear it?
Play it again. Is there music behind it?
Yeah.
No.
She would sound too.
There you go. Yep.
Okay.
Obviously you hope for the best, but I also, I had all those thoughts floating around in my head. I mean, they stop my child's heart. Her heart is the size of a walnut, and they pump her blood through a machine. They have a machine that makes her lungs work. Her heart is turned off. And the fear of my baby, my first baby, my only baby, that, I'm a first-time mom, and the thought of that, it's gut-wrenching. It's soul-crushing to think that my precious little baby would lay on that table. Those four walls of the hospital can be suffocating. I was like numb in a sense, and then I was just crying all the time. It was awful, and I remember like holding her and like looking at her and then snuggling with her and knowing that she has no idea what she's going into. It was just sad, But then we get here and we get our room and we go in, and I kid you not, it was like Christmas morning. And like, she has so many toys. I think I got more here than I got at my baby shower. We packed what we thought were the essentials, but y'all thought of things that we didn't even think about. In terms of toiletries, and there were ponchos, and I was like, didn't think about that. What if it rains? Because as a parent, you're so focused on taking care of your child that you're not taking care of you. So the Ronald McDonald House was here to take care of us. And it's whenever you're in that moment and your mind is so hyper-focused on your child and worrying about your child and have they made their rounds yet? Have the doctors come by? Have the nurses come by? Oh, her next medicine. Oh, her next bottle. You're so focused on all of those things, and then you walk the Ronald McDonald House, and there's a little pony all dressed up. Like, it could just really shift your mind. A lot of people think it's the financial aspect of you're going to be at a hospital for a long time, and a hotel would be so expensive. But that's the base of it. That doesn't even scratch the surface of what this place is. After staying here, I became a donor myself because I believe in this mission. I believe in this house. Ronald McDonald House was here for me when I needed it the most. It's more than a bed. It is a hug. It's a smile. It's a friendly conversation when you are so engulfed in this depressing hardship that you're going through. And Ronald McDonald House is there for families. I was blessed in the fact that we were only here for 11 days, but their families are here for months. Knowing that the donations that you're giving to Ronald McDonald House are going towards feeding these families and giving them ponchos and, and giving them a safe place to feel their emotions and a safe place to just grieve how they need to. There are so many perks to staying here. And when you're going through such a tough time, it's so important. All those little things add up in big ways, and they make huge impacts on these families. And so if you are considering being a donor to Ronald McDonald House, I would more than recommend it. And if you are a donor, I would say thank you from the bottom of my heart, because I got to experience those things that you donate to, and I was a first-hand recipient of them, and they really are life-changing, and they make all the difference. They really do. So I absolutely would recommend donating to Ronald McDonald House as a donor myself and someone that once stayed here.
All right, guys. So that is Emmy's story. Her mom, Virginia, and their family are doing perfectly fine. Virginia actually added a new member to their family about 8 months ago. Emmy is now a big sister. And her new sister does not have any cardiac issues, which was huge for them to hear after going through all that with Emmy. But like I said, nobody can tell our story better than our families. And even though this was kind of from like a more donation perspective, it still gives you kind of an idea of all the fun things we have at Ronald. So what's our mission, right? Like, what are we all about? Our mission is that we provide essential services that remove barriers, strengthen families, and promote healing when children need health care. Our ideal vision is that one day there'll be a world where every family has what they need to ensure the best health outcomes for their children. Our vision, of course, is that one day, hopefully no one will need us. But until then, we're going to be here, and we're going to be here to provide any kind of service. So just our values, this is how our staff, our volunteers, our board members, we all lead with these values in mind. Leading with compassion, being deeply respectful, integrity, and we're firmly committed to our mission. So how did Ronald McDonald House get started, right? Like, where did all this start? I don't know if we have any football fans or anybody who is a Philadelphia Eagles fan, but they played a huge part in starting the first Ronald McDonald House in Philadelphia. There was a player on the team, his name is Fred Hill, and his daughter was being served at the Children's Hospital of Philadelphia for leukemia. And the owner of the team at the time, Leonard Toes, saw that they were sleeping in waiting rooms. There were parents eating out of vending machines. I was like, why is there not something for these parents who want to be by their child's side while they're in the hospital, whether it's overnight or whether it's for months, where they can be close by but still have that sense of a normal routine, having a bed, having a hot meal, that kind of thing. So he approached the creator of McDonald's and owners and operators in the area, and they started raising money for the first Ronald McDonald House. First Ronald McDonald House is still operating in Philadelphia and still serves hundreds of families from the Children's Hospital there. It has since expanded, obviously, since it first opened, but we have over 380 houses worldwide now, which is amazing. And this year is a really, really special year. So Global Ronald McDonald House Charities is celebrating 50 years. So it has been 50 years since the first house opened in Philadelphia. So we are having a huge annual conference in July, and a lot of our branding and marketing this year has kind of been focused around celebrating that. So what's our global impact, right? I know a lot of you are probably not from Charlotte and are from other places. RMHC is everywhere. I would be surprised if you could name a city, a state, and there not be some sort of RMHC program there. 90% of the top children's hospitals around the world have at least one RMHC program. Last year, we helped over $600 million, families save over $600 million in accommodations and food expenses. We're in over 62 countries and regions around the world. And of course, that means millions and millions of families by our programs. So this is my work. This is where I am currently, the Ronald McDonald House Charities of Greater Charlotte. This is just kind of a picture of our outside on our front lawn. When did we kind of get started? We opened in May of 2011. We're actually considered one of the newer houses in the RMHC system. We're about 35,000 square feet. We have 28 private guest rooms with each a private bathroom. Our guest rooms totally vary depending on the needs for each family. So if it's a mom and dad and they, are bringing two siblings, we might put them in a suite, or we'll put them in a room with two queen beds, or maybe we'll have a queen bed and bring in some cots for the kids. And then sometimes we'll have like dad and grandpa, and maybe they want two twin beds. So we have a lot of different room layouts just depending on your family dynamic, and try to, best suit those needs. Every Ronald McDonald House you go to is different. We kind of mirror the look to our neighborhood that we are in Charlotte. But you go to Tampa and stay at the Ronald McDonald House there, it's going to feel like a beach house. You're going to feel like you're on vacation. And then if you go to like Utah, you're going to have a more cabin feel. So that's another kind of fun thing about the design of Ronald McDonald houses is they're all different. And so no matter where you go, they're going to kind of mirror that geographical area. Here at Charlotte, along with our 28 bedrooms, we have a playroom on site. We have a full laundry room on site, a teen room, which has pinball, pool, Xbox, video games, all kinds of fun stuff for the kids and the dads. And then we also have a library as well, where a lot of our parents who work from home take meetings there. And then, of course, share reading with their children. Since we've opened, we've served over 7,000 families just here at the Charlotte location, which is amazing. So a little bit about our families. How do you qualify? I know that Jett Foundation had shared a little bit with me about how people maybe didn't think that they were eligible to stay at a Ronald McDonald House. And really, there's not a lot of requirements. You just have to have a child under 22 years of age receiving treatment for us at a Charlotte area medical facility, but for wherever your house is, it would be for that area as well. That's under 22 years of age. Whatever county the Ronald McDonald House is in. So for us, it's Mecklenburg County here in North Carolina. We'd be required to live outside of that, or sometimes they have certain like 50-mile radius, 30-mile radius, that kind of thing, that would exclude you from staying at that house. The third thing is really important. You must be referred by a medical facility where your child is being treated. So that can be a social worker, a child life specialist, or the physician that that the patient is being seen by. And that would them simply being like submitting a referral from whatever Ronald McDonald House website that they would go on and do that for you. There's no limit on the length of stay. Families can stay with us. The longest stay here at the Charlotte House was 439 nights. So that's over a year that little Zaire, he's from Roanoke, Virginia, and his mom Pam stayed with us. And then we also have families that come and just stay simply overnight. Maybe they're coming in for a checkup. Maybe they're coming in for just a quick scan, whatever. And they just, it's too much to drive back in one night. So we get referred to them by whoever's seeing them that day. And then they're welcome to stay overnight with us at no charge. So no matter which Ronald McDonald House you go to, there are families from all over the world that are traveling to these top children's hospitals for world-class healthcare. Here in Charlotte, right here on the right, this is Diarya's family. They are from Bombay, India. They come and visit us twice a year for Diarya to participate in a clinical trial here at our local children's hospital. And then we have people who are just from like neighboring counties that stay with us as well. So it's also a really great opportunity to kind of meet people who are going through similar situations, maybe or even have the same diagnosis as your child, and kind of share those experiences and bond with each other over that. So just talking a little bit more about our demographics, like I said, babies, children, teens under the age of 22. The diagnosis for people staying at a Ronald McDonald House it just varies. It depends on the house. There are some children's hospitals that specialize in certain things. And of course, those houses near that are going to have more families that are coming in with those, top programs that they're treating. Here in Charlotte, some of our top diagnosis is prematurity, cardiac issues, and then oncology. So depending on their treatment, we do have patients that stay in the hospital and then their families are staying with us, so they are inpatient. We also do have outpatient that stay with us as well in a room with their families. It just depends on the treatment. So it costs a family nothing to stay at the house, but how much does it cost us, right? Just thinking about us being a nonprofit and relying on donations. It costs us about $130 a night here at the Charlotte House for a family to stay. So that's why it's so important for us to fundraise and keep those dollars coming in so we can provide those free accommodations. No family is turned away due to financial reasons. You can stay one night, you can stay 439 nights, and you're not required to pay a dime. Most of the time, you will be asked if you'd like to give a donation at the end of your stay, but you are in no way, shape, or form required to. And families are not evaluated based on income. Families are only evaluated by those qualifications that was listed before on the previous slide. That's the only way that you are qualified to stay at a house. So getting started, just compressing it together, going over how can you stay at a Ronald McDonald House. So social service department or your child's physician at whatever hospital you are getting treatment at, and it doesn't have to be a hospital as well. We have a lot of people that go to different types of outpatient therapy centers or just medical offices, but maybe it's still a quite amount of distance from your house. You are still eligible to stay at a Ronald McDonald House. It does not have to be classified as a hospital. So they'll place your name on a wait list for whatever day you kind of tell us you intend to arrive. Just because we have so many families on the wait, coming in and out, and for us, we are at full capacity most of the time. We are looking 5 to 10 years, to expand and grow and have more rooms because of the demand. But that also just depends on the house that you're inquiring with. But since every child's treatment is so different and so unique, it's really unpredictable to say how long someone's going to be here, if they're going to check out, have a room, maybe we will, maybe we won't, kind of thing. So that's why it's always nice to plan ahead and get in touch with your physician and make sure that they send those dates over to us as soon as possible so we can have you on our mind. And like I said before, you can stay as long as you would like, as long as your child remains in active treatment and is being seen, or has we just had a baby recently discharged, but she has a checkup appointment later on this week. So we weren't going to make them, check out and then come back. So it just kind of depends on how that treatment process and how that treatment length looks like. So in many houses, some of the resources available is comforting meals. We serve dinner 365 days a year here. You're never going to have to eat out of a vending machine. You're always going to come home to a hot meal prepared by either, a staff member or a volunteer meal team from the community. Lots of businesses, organizations, churches love to volunteer and bring their wonderful cooking skills to us. Quality sleep, you're going to have a nice bed to sit in. You're not going to be in a waiting room in the hospital. And then also all the different rooms that we have at our house that are similar to ones that your own if you have small children. We're going to have playrooms. We're going to have the teen room. We're going to have activities for your family to do, which is always nice. Children are in the picture. Some of the other additional resources at some other houses are different recreational activities. I know some of the houses in Southern California and New York and larger states, they actually have camps. Camp Ronald McDonald is what it's called, which can be for kids and their siblings as well, which is super cool. So that's kind of like a day camp kind of situation. Non-clinical support services such as children's art therapy, music programs, and gardens. And then, of course, sibling support services, because we as an organization really focus on the family as a whole. We believe that when there is a sick child, it's a sick family. So we not only focus on the patient, but the mom, the dad, the siblings, the grandma, the aunt, the whoever is in the picture, so they feel supported as well. So a little bit about the meals. So here at the Charlotte House, and it's a very similar situation at any house you go to. We have dinner crews 7 days a week, 365 days a year. That's every holiday, every day of the week. So, we have a Thanksgiving meal, we have a Christmas meal, we have, we try to have like little themes for holidays and whatnot. We do breakfast on the weekends, which is always fun, especially going into the summertime when all the siblings are going to be in the house since school is out. Everybody wants breakfast. And we recently started a new program as well for brunch crews. So we do brunch on Wednesdays, which is super fun for the families, and has a little mix of that, lunch and breakfast feel. We also have casserole crews, which help us fill in those meal dates that we do not have like a full meal team to come and volunteer. So those casseroles would be served and provided by a staff member in exchange for like having a full meal team here. And cookie crews. I don't know if anybody knows this, but RMHC takes cookies like to a whole other level. It is a huge part of our brand. There's actually a really cute RMHC commercial that is based around a kid and a cookie. And we think cookies just really make you feel at home. So I'm not sure, of course, other houses probably bake similar amounts, but here at Charlotte House, we bake about 7 dozen cookies a week, which I know seems really crazy, and it makes it really hard to work here and not want to eat all the cookies. But that's just something a little sweet and a little sentimental that we include for our families as well, that they can grab and go while they're going out the door. Another perk of staying at a Ronald McDonald House is, you're definitely allowed to go buy your own groceries if you're going to be here for a suitable amount of time. And we have places for you to put your groceries, but we do have, donations that we get. And so there's complimentary pantry and fridges, anything from juice boxes, milk, chips, cereal, ramen bowls, oatmeal, things like that, quick and kind of on the go kind of meals and refreshments are all provided to our families complimentary. So our on-site activities, so these are just some of the ones that we have here at the Charlotte House. This can totally differ from whatever house you go to. We love pet therapy here. Our families love to have our furry friends come in and hang out with them. That is a question I get a lot. Can you bring your pet with you to the Ronald McDonald House? And unfortunately, the answer is no. If it is a service animal or that kind of thing, there is a whole other process for that. But we do provide pet therapy to kind of help our families remember their furry friends at home, and also it's really great for just promoting that kind of community feel and getting to know each other. Arts and crafts, bingo, face painting, music trivia, movie nights. We have a local nail salon here that comes in and does manicures for the moms on Monday, and the dads, whoever. We have free haircuts on site twice a month. And then there's also a massage therapist locally that comes in and is going to start offering chair massages to our families as well. We have an app, and you can sign up on that. So it's very tech savvy and really quick to do. And you just sign up and you come down at your time and get your free haircut or your free massage. So it's really, really nice. Just one of those little extra perks of staying at the house, and also just kind of giving that comfort feel to our families for that home away from home. So the house is majority what people think about when they hear about Ronald McDonald House Charities. They think about the Ronald McDonald House, how you stay there, all that. But we actually have other services as well, which some of you may also, qualify for. So here in Charlotte, we have the Ronald McDonald Family Room at Caroline's Corner. This is in Henby Children's Hospital here in Charlotte, but there are family rooms all across the world in different hospitals. Some of them, are bigger than others. Some of them are smaller than others. Some of them actually have, like sleeping pods in them. Ours is more like a large kitchen with a living area and a dining space. Just a place for families to come and relax and kind of recharge, grab a snack, grab a drink, maybe do homework outside the hospital room, or come and like get a game or get a movie and get a book, that kind of thing. We also have a shower and laundry facility with our family room, which is pretty similar to other ones as well. And this is all smack dab in the middle of the hospital, just steps from children's hospital rooms. So it's only just like a quick run down the hallway to grab a snack or grab a drink or throw in a load of laundry. If for some reason you're not able to stay at the house, it's kind of an extension of that hospitality. So just to give you kind of an idea of what family room is like, this.
A Ronald McDonald family room. It's a peaceful place. It's an intimate place. It's a comfortable place. It's a private place away from the medical space.
So again, family room, close proximity to the child's bedside, a place to relax, amenities for all family members, a kitchen and snack, private bathroom, shower facility, sleeping rooms, sleeping pods, internet access, lots of reading materials, a seating area with a television. It's also just a quiet place for you to come and just kind of get with your thoughts and be away from all the beeping and the prodding and all that in the hospital. Another one of our programs we offer is our Happy Wheels hospitality carts. And so these are also all throughout Ronald McDonald House chapters. So this is an extension of the house and the family room as well. It's kind of our family room on wheels, so to say. So this is a picture of our Women's Center and NICU Happy Wheels that goes around in our hospital here in Charlotte. And so they can be in multiple locations. Right now we have Happy Wheels carts in 3 different locations, working on installing our 4th location a little bit north of us in Concord, North Carolina, at Jeff Gordon Children's Hospital. And Happy Wheels carts really just differ depending on where they are. You know, what you have on the cart in the Women's Center is going to be exactly what that mom to be wants or needs, or what that dad who's bored and is sitting there, they've been labor for hours, you know, it's anything like that. You know, you run out of the house in an emergency situation, leave your phone charger. We're going to have a phone charger for you. We're going to have free snacks. We're going to have free refreshments. We're going to have an activity for the siblings, for the kids waiting in the ER waiting room for hours to occupy them, just to kind of give you room to breathe. So anything like that is just those comfort and care items that, you know, are essential in a setting, in a hospital setting. We do not have this program here in Charlotte, but they are at a lot of different RMHC global chapters, is the Care Mobile. So the Care Mobile is basic medical and dental services on wheels that go to different like low income areas within cities. I know, like, I think the closest one to us is probably Atlanta that has one, and it's just facilitating, you know, preventative care for those kids. And there is a way for you to reach out to your local Ronald McDonald House chapter to see if this is a program that they have, and they can advise you on how to get signed up for the next time the mobile care unit rolls out. So just a little bit more about that, you know, dental care and follow-up, medical diagnosis and treatment. There's also a lot of health education resources on the mobile care unit that can give you more ideas about how to deal with some common health issues in the area. So this is just some of our numbers. I know you're probably like, whoa, that's a lot of numbers. So this is our impact statement from just 2023. With adding on the family room and the hospitality carts, so now here in Charlotte, we have 3 programs. We served over 4,000 families just last year, which is crazy to think about. And if you look at the amount of visits in the family room, the visits in the for the Happy Wheels, you know, that's really what drove our numbers up. And this is just a way for us to reach out into our community. Like I said, here in Charlotte, if you live inside our county, which is Mecklenburg County, you are not qualified to stay at the house since you are in more of a closer proximity. So this was our way of providing as much of those services we can to people who are either staying at the house or can't stay at the house. It doesn't matter, your home location. Anyone qualifies for the services provided by the family room and the hospitality cart. So if you've ever thought about, like, maybe I want to volunteer, there's lots of different ways to get involved. Our individual volunteers work with the Happy Wheels in the family room, and our house operation volunteers, they do lots of different things like pack welcome bags, turn over rooms, push the Happy Wheels cart around, serve drinks and refreshments to families in the hospital. It just varies. And then our group volunteers are more like our meal teams, our cookie teams, our activity teams coming in to host bingo or music trivia, that kind of thing. And then there's teens and kids. You're like, I want to get my kid involved in something that's given back to the community. We collect pop tabs all throughout the RMHC system. Most houses do collect pop tabs and recycle them in exchange for a donation in return. So a lot of people bring us their pop tabs. It's a really fun way to get kids involved. A lot of schools get pretty competitive about it and do different little competitions. And it's really cute. And next week, actually, here in Charlotte, we're having a Pop Tab Pandemonium event. So it's just a whole week where we try to collect over 2 million Pop Tabs in 1 week. And so everyone in the community brings out their collections that they've been saving up for weeks or years, and we dump them in these big bins. And it's just to bring awareness to our cause and to how little it takes to actually give back to RMHC. So that is a little bit about us, you guys. I'm more than willing to answer any questions you have. So yeah.
Awesome. Thank you. Thank you. Thank you.
Yeah.
I think, one of the things that, I thought about when you were talking about Ronald McDonald House and, what's offered and how, people are eligible. I think something to think about for this community too is the fact, that we do have people who are doing clinic appointments that aren't necessarily in their area. There's a lot of people that travel, hundreds of miles to go to clinic, and that this might be an option so that they're not having to, stay in a recliner chair, or, that's an option as they are receiving, treatment from those facilities. And, one of the things that I had talked to Jessica about a little bit is, if there is a provider that is hesitant or is kind of giving some pushback on a referral, please reach out to, to us, to Jessica or whoever, so that we can help walk you through that process. Cause this is a really great, organization and a really great opportunity for families to feel a little bit more at home in a setting that's so not homey. If anybody does have any questions, please go ahead and either pop them in the chat or the Q&A box. I will go ahead and look on Facebook to see if there's anything there as well. But we also know that sometimes, you need some time to think of questions and formulate questions. So if there are any questions after the fact, we're happy to send them over to Kayla to see if we can get any of them answered. But I do want to thank all of you for being on here. If you do know anyone who could benefit from this webinar, or hear anybody who's asking about RMHC, please go ahead and send this webinar over to them as well. This is Kayla's information. She's happy to chat. Also, we do have a question. Do you support with any equipment that may be needed? So hospital beds, Hoyer lifts, those types of equipment needs, instead of families having to bring their own.
Yes. So that's definitely, just dependent on what that house has resource wise. But that's definitely a question you could ask when submitting referral, is what do you have on site? We do have wheelchairs, lifts, that kind of thing, available if that's needed. So it would really just depend on the house, but that's definitely a question you should go ahead and submit during the process.
Awesome. I have a question based off of that. I know it probably differs per family and per location, but on average, at least in Charlotte, what would you say the turnaround time is between submitting a referral and being accepted as, being able to stay in this program?
I'm gonna say it's anywhere between 2 to 3 days. But there are times that we have families check out and we call a family, and be like, can you check in within the next 3 hours? And they're like, yes. So it just depends. But also for us here in Charlotte, we are at capacity over 80% of the year. So the demand here is high and we don't have enough rooms for the need that we have in the community. So that's also different with whatever house you go to. I mean, like Chicago, for example, has a high rise of rooms, over 100 rooms. And then like there's a house in Augusta, Georgia, that's as small as 5 bedrooms. So it really just depends. So that's why it's good to, like, when you go to those appointments and I'm going to have to come back in, June of 2025 or whatever. At least I'm going to say, 4 to 5 months ahead of time, like go ahead and put that bug in our ear. And then the family services department, kind of plan accordingly.
Yeah, absolutely. Yeah, there are definitely times where families are, staying 2 days for clinic appointments. So, and they usually, know those well in advance. So that's really good advice. Any other questions? If not, we will go ahead and thank Kayla again. And if you guys need anything or have any questions, we are here to help and happy to connect you with Kayla. Again, please go ahead and share this with anyone you think might benefit from it. And we will chat with you soon. Thank you so much, Kayla. And congratulations again.
Oh, thank you.
The new, I don't want to say new life, but like the new
I know
adjustments to
it
the
is.
fiance
It
and
is
everything
different.
else.
Yeah, and I also wanted to say, we have a lot of connections with people at other houses. We email. That's a good thing about this network is we really work off each other and each other's ideas. And so if you are, planning to go somewhere and want to get connected with someone specific at a house, please don't hesitate to reach out. I'm more than happy to connect you with those people. And then the QR codes here just lead to our Charlotte website and then also just globalrmhc.org to get more information on any of the programs.
I do actually have a question based off of what you just said. If
Yeah.
someone is not able, if you are at capacity and not able to accept someone into your house at that time, do you work with them to try to find other options for them?
I'm really glad you asked that because as soon as you started asking that question, I was like, oh man, I should have included that. Yes. So here at the Charlotte House, we work with the Fairfield Inn in Uptown, which is just like about 5 minutes from us. And so we work with different hotel chains to get discounted rates for our families if we cannot have them stay.
Awesome. Well, thank you again. Let me just check over
Yeah.
here. I don't think we have any other questions. I think you did a really good job at answering the ones that I had. So again, thank you so much, Kayla. And thank you all so much for, taking time out of your day to hang out with us and learn more about Ronald McDonald House Charities. And, hopefully if you do need them in the future, they are available to you, but please feel free again to reach out to myself or Kayla if you have any questions, and have a wonderful day.
Awesome. Thank you guys so much.
Bye, guys.